Part of growing up is getting those metal brackets on your teeth to help straighten them, or if you're bougie, getting that Invisalign or other clear aligner that you don't really see as much. But what if there was a way to prevent getting that? For a while, we thought that having crooked teeth was just genetic and you're just born that way. But that doesn't really seem the case anymore. It's actually more about the stem cells in your jaw. And if these stem cells in your jaws are stimulated enough to grow wider and forward, then it would allow your teeth to come in the right place. Now, obviously, there are some conditions where genetics do play a part, where even if your jaw is wide, you can have an impacted tooth somewhere. But for the vast majority of people, if their jaws simply grew wider and forward enough, then their teeth would be straight. Unfortunately, there have been some changes in our jaws throughout the years, and really recently, that have caused our jaws to start getting smaller and smaller. But luckily, there's a way to prevent it. Now, if you're an adult and you already hit puberty, then you don't really have as much luck there. But I will say that a lot of these changes that I'm going to talk about will still help benefit you in a way. And they'll especially be able to help you in how you're breathing and how you're sleeping. Now, some of these tips I'm going to mention are going to depend on the age of a child as well. I'll be giving tips for babies and even children that are like 9 and 10 or older. But again, most of these tips are useful for adults too. So here are 11 ways to make sure your child never needs an orthodontist. The first thing is encouraging nasal breathing. Now, from an early age as possible, I recommend encouraging nasal breathing whenever possible. Now, this is one of those tips that can help adults too. The reason is breathing through your nose is just so much better than breathing through your mouth. And we have plenty of evidence that when kids grow up as mouth breathers, then they're more likely to have skeletal deformities. They're more likely to have longer, skinnier, narrower faces. They're more likely to have airway problems and sleeping problems, and also some psychiatric problems. And nose breathers, on the other hand, are more likely to have wider, more forward-growing jaws and straighter teeth. So one way to help encourage nasal breathing is a mouth tape. So it's just like the name sounds. It's literally a piece of tape that you tape over your mouth or even your kid's mouth. Yes, I know it seems barbaric, but it's actually going to help them. So if you're just first doing this, I wouldn't do this at nighttime. I would first do it in 10-minute increments during the daytime to see if your kid can even breathe through their nose in the first place. You can also do a nose unblocking exercise. And actually, I made a separate video on how to properly unblock your nose if your nose is blocked. So you can check that out in the description below. But then after these 10-minute increments, if it seems like your kid's doing fine, then I would start with when they're napping. See how they're responding to nasal breathing when they're napping, and if they're doing good there, only then would I transition to having them mouth tape when they're sleeping. Now again, with this, I recommend that child be able to choose where they're gonna sleep with that child, and whoever's sleeping with that child should also tape their mouth shut. Another way to help encourage nasal breathing is reading out loud, but at any pause, instead of breathing through your mouth, you instead breathe through your nose. So for example, if I'm reading a book and I have to pause, I would pause by breathing through my nose and then continue reading out loud from there. Now, you might ask how many kids are really breathing through their mouth that much? Well, you can even check your kid. So next time your kid or even you are watching TV or reading a book or something, check and see if your lips or your child's lips are open. If they're open, that pretty much means that they're breathing through their mouth. This study looked at 150 school children in Brazil, and they found that about 53% of those school children were mouth breathers. Now, the reason that breathing through your nose is so much better for jaw development specifically is going to bring us to number 2, which is having proper oral posture. Now, proper oral posture is going to be with your lips closed, your teeth slightly touching, and your tongue resting against the roof of your mouth. Not just the tip of your tongue, but also the middle part of your tongue as well. When your tongue is resting against the roof of your mouth and your lips are closed like this, then your tongue will stimulate the palate or the roof of your mouth to grow in a wider U-shaped direction. And in turn, your mandible or your lower jaw will follow your maxilla and also grow in a wider U-shaped direction. But when your mouth is always open and you're always breathing through your mouth, then your cheeks will keep everything constricted and then keep your mouth and airway narrow. It's also a good idea to have proper posture in general too. So when your kids are eating at a dinner table or something, making sure that they have good posture. We know that when people grow up as mouth breathers, and they also tend to have bad neck posture, where they have this thing called a forward head posture. And part of that has to do with them simply not being able to breathe properly. Because when you have this narrow jaw, then it's harder for you to breathe. And a common response is to tilt your head up a little bit. You know when people are doing CPR and then they have to give them some rescue breaths, what they do is they tilt that person's chin up because that helps open up the airway. It's kind of the same thing that people who grow up as mouth breathers start doing when they have these skeletal deformities. Their head starts tilting forward and their head starts tilting up as well. So definitely encourage your kid to have this proper oral posture and proper posture in general as much as possible. I know some people think that you should actually have your teeth apart all the time and your teeth shouldn't be touching. Well, there's evidence that having your teeth apart all the time will actually recede your maxilla and actually make your jaws smaller. And this can also end up leading to snoring and other airway problems, even if you breathe through your nose. The third tip I have involves eating and making sure that your child chews with their mouth closed and evenly on both sides of their mouth. You'll be surprised how many people chew with their mouth open, but chewing with your mouth closed will help engage those jaw muscles even more and in turn stimulate those stem cells in your jaw. A good number to gauge for how much to chew is about 20 times per mouthful of food, and that would be like 10 times per side. I would also encourage your kid for every single meal to just focus on chewing their food thoroughly for about 2 to 3 minutes. Because on the other hand, when people start chewing with their mouth open, first of all, that's just kind of gross. But when your mouth is open, you're not really engaging those muscles in your jaw because you're just kind of opening and it's a big hinge that's chewing that food. But when your lips are closed, then you're really restricting how much you can open that hinge in your jaw. You can also try chewing a tough chewing gum. There's a lot of different products out there of a more like a tougher chewing gum. Just make sure it's sugar-free. With this, I would encourage chewing for about 30 minutes a day and evenly on each side. Again, this is going to do the same thing and encourage those stem cells to grow. A quick side note here, if your child or you are developing some TMJ issues where you're having some jaw pain or something like that, then you probably want to stop this because anything that involves more chewing will aggravate this even more. Now, while we're talking about eating, I'm going to talk about number 4, which is chewing solid foods earlier. We have evidence that babies can start feeding themselves solid foods a lot earlier than we think. I recommend that babies should start eating solid foods starting at about 6 months old. Now, obviously this should be done with the parent supervision. You might even want to talk to your doctor about what foods to feed them specifically. But these early times are very crucial when it comes to jaw development because instead, if they're not really getting those solid foods, then they're missing out on a lot of quality time where their jaws could have been growing. Now, number 5 is avoiding pacifier use and thumb sucking as much as possible. These ones are kind of obvious, but thumb sucking and pacifier use will tend to make that mouth grow more narrow and also push that maxilla in a more forward direction, and not forward in a good way. We see these issues where it turns into something called an anterior open bite, where your front top teeth are pushed out so much because of all this pacifier or thumb sucking use. This can obviously lead to jaw issues down the road. So at the very least, I would try to stop this habit by the age of 3. Now, number 6 is breastfeeding. We have evidence that the longer babies will breastfeed, the less crooked their teeth will be. And you might wonder why, because we just talked about stopping thumb sucking and pacifier use. Well, the difference here is pacifier use and thumb sucking will push the tongue down and encourage a tongue down position and a mouth open posture, which will eventually lead to mouth breathing. Whereas breastfeeding, the baby has to fight more to get that milk out. And breastfeeding, on the other hand, will encourage the tongue to be against the roof of the mouth. And this, on the other hand, is really good for jaw development because, again, that tongue will encourage that palate to grow wider and forward, and also the baby's musculature will develop more. So if possible, I'd recommend breastfeeding for at least a year and possibly even 2 years if you can. Now, another thing you can do is after that baby is done breastfeeding, to close and pinch that baby's lips for a few seconds to keep them closed, and this will encourage that baby to only breathe through their nose. This is actually something a lot of hunter-gatherer tribes still do, and a lot of our ancestors used to do. Now, number 7 is orthotropics. Now, this is not traditional orthodontics. Now, this is basically a more specialized field of dentistry, where instead of orthodontics, where they kind of just pull teeth in the right position, they instead treat these misaligned bites and crooked teeth a different way. They do this by focusing on proper head and mouth posture. So they can actually make devices that will encourage kids to only use their own jaw musculature to have proper oral posture. Now, with this, it's better to go as early as possible. So I recommend going at least by the age of 5. But for example, they'll make a device that forces you to use your own musculature to keep your lips closed and your tongue against the roof of your mouth and your teeth slightly touching. And this will encourage that proper jaw development. The cool thing about this is once you get that proper oral posture dialed in and you have good jaw musculature, then you won't even need a retainer, because after orthodontics, you always need that retainer to hold your teeth in the right position, or else those teeth will magically go back to where they were, or not all the way back, they'll end up being crooked again still. But with orthotropics, since you're fixing the actual musculature problem, you're fixing the actual source of the problem, the source that's causing those crooked teeth, then theoretically you really shouldn't have crooked teeth anymore. And again, if you look back to our ancestors, and their skulls really didn't have crooked teeth even when they were older. Now, I have nothing against traditional orthodontists. I still think that orthodontists help a lot of people, and I work with them a lot. But you can't deny that it is expensive. And if there's a way to fix the source of the problem, why not try that? And all these other changes that I've mentioned so far, and I'm gonna continue to mention, will still help encourage that jaw development. But there's no denying that we don't live like our ancestors did. Our ancestors used to live outside and they would chew food for about 4 hours a day. We're just not gonna have that lifestyle anymore. So even if we make all these changes, we're probably still not gonna get the same results of having those wide, spacious jaws like our ancestors did. So a lot of times we're still gonna need help, and that's where orthotropics can come in. Now, number 8 is going to the dentist early. So I always recommend taking a kid to the dentist as early as 1 year old for the first visit. This may seem really early, but it's gonna help that kid in a lot of different ways. For one, it's gonna make that kid more comfortable with being at the dentist office. And two, the dentist can still check for any cavities and any other problems earlier on, because the earlier we address these, the better. And you'll be surprised, even 1 year olds can still get cavities. And number 3, if the dentist does see a problem, then they can tell you about it. And it doesn't just have to be a problem with that child's teeth. That dentist can also check how that kid's jaw is growing, and even the position of their teeth. A lot of times I see kids with perfectly straight baby teeth, and their parents think that, oh, because their baby teeth are straight, that means their adult teeth will come in straight. But baby teeth should really have some spacing in between them, because your baby teeth are a lot smaller than your adult teeth. So if all your baby teeth are touching, then your adult teeth are not gonna have enough room to come in. So sometimes it's a good idea to go to an actual orthodontist now and get an expander made to expand the jaw. Because if you have a child whose baby teeth are all straight and touching, then I guarantee you that their adult teeth will come in crooked. Now, the dentist can also check other things like the tongue and the lip, because sometimes people have a tongue tie or a lip tie. Basically what that is you have this attachment underneath your tongue, and this attachment is what connects your tongue to the floor of your mouth and your lip to your gums. But if that attachment is really short, then it can cause some problems. It can make it harder for your lips to close, and it can also make it harder for your tongue to touch the roof of your mouth. And this brings us to number 9, which is getting a tongue tie or a lip tie surgery. So this is something I always check in my office. I always check for tongue ties and lip ties, and I see how big of an issue this is. If it really prevents having proper oral posture, then that means it's probably going to prevent having proper jaw growth. So a lot of times a simple surgery can be done to just clip that tongue tie or clip that lip tie. And then this usually involves some sort of exercises with the tongue or the lip. And these exercises are really to make sure that there's no scarring or anything like that, and make sure that that attachment doesn't grow back. But this can really make a difference in the long run in terms of having proper posture and having proper mouth posture. Now, number 10 is gonna be going to an ENT, or ear, nose, and throat doctor. A lot of times in my office, I'll do a quick airway exam where I check the tonsils, I check the nose, and I check how well that kid is able to breathe. There's also some other dental signs I'm not gonna get into that might indicate an airway or a breathing problem. But if I do see something, that's when I'll usually refer to an ENT to get their airway examined. So here, for example, they can check things like your tonsils and your adenoids. And if those are super big and blocking off your airway, then you might need a surgery to get those removed. This is really common in kids. Now, I would always avoid getting a surgery when possible. But if it's causing a real serious issue, and it can really provide a lot of benefits, then sometimes there's no other choice, because it's also affecting that child's jaw growth as well. There was a Swedish study where they had these kids between 7 and 12 who had trouble breathing through their nose. And they were able to restore their nasal breathing by getting their adenoids removed. In turn, these kids ended up getting more horizontal growth of their jaws by simply getting those adenoids removed. So this is why I say it's always better to catch things early. So going to your dentist, going to your ENT, earlier on may seem like a waste of time or a waste of money, but it can really pay dividends later on. Now, number 11, the last thing on my list is to avoid allergens. These are things like minimizing dust exposure, so keeping your house clean. I'm looking at you. Did you clean your house today? We are exposed to way more dust living indoors than our ancestors were when they lived outdoors. Now, I'm not saying to go live in the wilderness because I definitely don't want to do that. But this dust can contribute to a lot of breathing problems and trigger some allergies, which can in turn make your nose blocked and turn you into a mouth breather. And we already know how this will affect your jaw growth. You can also minimize any aerosol sprays. You know, people that unnecessarily spray their living room all the time when they don't really need to? All those aerosols are still getting into your nose and they can still aggravate your allergies or even your asthma. So thanks for watching, guys. I know I talked about a lot, so if you have any questions, make sure you let me know in the description below. There is an epidemic going on that no one is talking about. It has to do with the shape of our jaws. Now, this might not seem like a big deal, but when you start to understand the problem, you'll see why it is a big deal. The shape of our jaws has been getting smaller and smaller. If you don't believe me, look at some anthropology records and you'll see that our